Good morning, my name is Amy and I am the founder of Pulse Dermatology and Laser. And today I have with me Janine. Janine is our head medical aesthetic therapist at Pulse, and she does most of the laser work. So our lasers run from morning to night. And today we are going to talk a bit about the Soprano XLI, which is our laser hair removal system, and it is the Rolls-Royce in laser hair removal treatment. So Janine, what are some of the questions that patients ask you when they come in for laser hair removal treatment?
Well, normally when I have a first-time patient, the first question is it painful?
Okay, all right. So we're really lucky because the Soprano XLI is both pain-free, and then we've also got the shot-for-shot medical laser, which can be quite painful. What hair types, what colors of hair respond best to laser?
So laser works on a contrast. So you're looking at the darker the hair and the lighter the skin, meaning the better results. Laser hair removal is not really going to work on your lighter pigmented hair, so your grey hairs or your finer blonde hairs. We do have alternative treatments for that, but for laser hair removal, it would be your contrast, your darker hair, lighter skin.
So it's not rocket science. All a laser is doing is it's going no pigment, pigment, and it attaches onto pigment. So the bigger the difference between the skin color and the hair color, the bigger, better result the patient is going to get. I also find it's not as effective on ginger hair, and in that case we definitely will look at electrolysis, albeit a lot more painful. What would you normally use on someone with a darker skin, for instance?
So I would normally go with the in-motion technique to eliminate any painful experience that they might have.
Yeah. So basically, in-motion laser hair removal is where we break up the shot of laser and it shoots 10 pulses per second. So what Janine will do is she will massage the laser head over the area, and it will pulse and pulse and pulse and pulse, and so you can get a lot more energy into the area, and it's a lot more comfortable for the patient and also a lot safer. So the reason that we would use that on a darker skin tone is because that will eliminate the risk of any burning, and you're actually getting a lot more heat and laser into the area, so it makes for a lot more of an effective treatment. We very rarely use the shot-for-shot laser, but only in stubborn little cases we will use that as well. Let's talk about how many treatments patients would need. What is sort of the average for a woman?
So normally between 6 and 12 sessions for male and female. Depends on the area that we're treating, if it's a more hormonal area or a more stubborn area where the hair's coarser and thicker.
Yeah. So yes, it's got a lot to do with hormones. That's very important to know. So for instance, during puberty, we get hair under our arms, men can get it on their shoulders and back, and on our bikini areas. Now this is hormonally driven hair, so they're generally a lot more stubborn. So the legs, I find, respond really, really well because we're born with leg hair. But hormonal areas, they do need some sort of a maintenance.
Yeah.
All areas need some sort of a maintenance, but more so the hormonal areas. I do also find sometimes men do need some more. It's not every time, but I think because of the androgen and the testosterone, this stimulates hair growth. So it's very important to take that into account. What is the average that a patient would come for maintenance after they've done sort of 6 or 12 sessions?
So then I'd probably see them every 6 months. Well, we'll build it up. So we'll have a 4 to 6 week interval between treatments, and then we'll see each other maybe every 3 months, and then we'll see each other every 6 months, and hopefully get to the 1 year treatment to make sure that we are eliminating the hair growth and keeping the hair stunned.
Yeah, so that's also very important to know, is that during your course of 6 to 12 treatments, you're not necessarily going to come monthly. We are going to sort of tailor it to your needs. Each patient is a little bit different. And then I've had patients that comes in 1 to 3 years later before they get hair growth. So it's not a case of like one size fits all. Every patient is going to respond at a different rate.
Yeah.
And then another thing is, when you come in for a maintenance treatment, it's never that full growth that you would have. So I have maintenance on myself now. Every 6 to 8 months I'll have my underarms done. But it's literally about 5% of the hair that was there originally. Obviously I'm used to really, really smooth, and so like before the summer, before I start to wear my shorter top spaghetti straps, then I just want to have a quick session just to keep those hairs at bay. Anything else that they ask?
Normally they'll say to me, when will I start seeing results? How long until I start seeing that the hair's going away?
Okay, so it's different for every patient, but generally from the first 2 weeks, I would say. So what happens is you have your treatment, you shave on the day, and then nothing happens. Like, it might stun the growth, and then the patient will be like, it didn't work. And I'm even like that on myself when I have a treatment. I'm like, did it work? Did it work? But then after 2 weeks, the hairs literally just start to fall out. If you've got any more questions, please feel free to contact us. We'll be happy to help. Bye.